Acne scar treatment. Acne scars develop after severe cases or when the acne has been forcibly picked or scratched. There are many types of acne scars, each entirely treatable. The only sure method of acne scar treatment is prevention early on. In general, you should never pick or squeeze acne, especially inflammatory acne or pustules. Squeezing forces infected material deeper into the skin, causing additional inflammation and possible scarring. But there are many acne scar treatment options. All acne scar treatments are short procedures, 15 minutes to an hour, but recovery times vary from 15 minutes to many months. Scabbing, redness, swelling, flakiness, dryness, bruising and uneven skin tone are common post-treatment effects. Acne scar treatment can cost anywhere from $50 to over $3,000. Ask a dermatologist which type of acne scar treatment is right for you. Dermabrasion works on shallow acne scars. For decades, sandpaper was used to scrape away damaged skin, allowing new skin to grow in its place, but now machines with rotating diamond-edged wheels are used. Laser resurfacing is a newer resurfacing technique, with the same effects as dermabrasion. Penetration depth into the skin is more easily controlled with a laser than with dermabrasion and other methods. Chemical peels are designed only for the lightest of cases. It involves application of different types of acid to the skin in order to remove the top layer so that a smoother layer can surface. Punch techniques are used for deep acne scars. Punch replacement or excision involves removing the pitted scar, followed by a skin graft or suture. Punch elevation, on the other hand, just cuts the scar loose and allows it to float up to the level of surrounding skin. Subcision is a method whereby the scar tissue is broken up underneath the surface of the skin, forming a pool of blood under the scar. The blood clot helps form connective tissue under the scar, leveling it with the surface. Dermal fillers are used for deeper acne scars. Material, often collagen or fat, is injected under the scar to bring it to surface level. Injections usually last about 6 months, although research into the longer-lasting materials continues to this day. Acne scar treatment techniques. Acne is one of the most common and bothersome skin conditions for adolescents. Although acne itself is not curable, even the most severe cases can be treated effectively. For these severe conditions, various types of acne scar treatment are available if warranted by the situation. Recent estimates indicate that 85% of the population between the ages of 12 and 24 suffer from acne. The severity and amount of time a person has acne can vary from person to person, but for most of us, it will eventually go away by itself. It is true that even mild acne may affect normal social activities because of the undesirable changes to your appearance, but this is considered more of a nuisance than anything else. Unfortunately, there are more severe forms of acne with greater consequences. In addition to being painful, severe cases of acne can cause serious scarring. Acne scars can occur in both mild acne or severe acne, but the chances of scarring increases as the acne severity increases. Luckily, you have the option of choosing between several acne scar treatment techniques available. The purpose of acne scar treatment is to restore your skin to its original appearance. You will find, however, that restoration is not always 100%, but acne scar treatment works to make the scarring almost invisible. There are a variety of techniques available to remove acne scars, and each one uses a different approach. It is recommended that you consult with a dermatologist to determine the best technique based on your type of acne and the severity of scarring present. At this point, you may be asking yourself how acne scars occur. In general, acne scars, and other types of scars for that matter, result from tissue damage. After tissue is damaged, the body will begin healing itself and in the process discourages any chance of infection. Your body sends a special chemical called collagen to the affected area. Sometimes, the collagen is produced in excess and develops into an irregularly shaped fibrous mass resulting in an acne scar. Other types of scars that may also occur include soft scars, depressed scars, ice-pick scars, atrophic macules, and many others. For the most part, these types of scars are caused by the loss of tissue from a particular area. Injecting collagen under the surface of the scarred skin is one of the most popular acne scar treatment techniques being used. The purpose of this technique is to puff out or restore the skin, which makes the scar much less noticeable. Another acne scar treatment technique is called autologous fat transfer. This process uses the fat from one part of your body for injection into the affected area. This helps to fill in the scar, but since fat is eventually absorbed into the body, repeated applications may be needed. Other effective acne scar treatments include laser or dermabrasion. Skin grafting and even surgery is a possibility, but these procedures are only used in the most extreme cases. Hopefully, you will not have to undergo any of these techniques to address your acne, but if scarring is present, with the help of your dermatologist you will be able to make an effective choice. Acne scar treatments. The best way of removing acne scars. There are many ways to treat acne scars. Determining your treatment depends on the type of scar and quantity of scarring. Before you consider a scar treatment, you should have an in-depth conversation with your doctor. It is very important you only use this information as an introduction to scar treatments and not a final guide. Your dermatologist and you can discuss the proper treatment after you have basic knowledge. For very mild acne, a chemical peel might be all that you need. Different types of acid are used in this procedure. It is recommended that you choose another method of treatment if you have very noticeable or deep scarring. The chemical peel procedure takes about 15 minutes. The resultant facial redness may last up to a few weeks. There are a few choices available to treat moderate acne scarring. The most popular are dermabrasion and laser resurfacing. Dermabrasion is a scar treatment in which a diamond-plated wheel is used to sand your face. This technique has been around for a long time, and sandpaper was once used instead of the new machines that utilize the diamond-plated tool. Generally, this procedure takes around an hour to perform. You should expect some scabbing and redness for a few weeks. This method is most effective for individuals with very pale or very dark complexions. The other treatment for mild acne scars is laser resurfacing. This treatment involves removing old skin with a carbon dioxide (CO2) or erbium laser. Depending on the size and frequency of the scars, the treatment may last only several minutes or in excess of an hour. This treatment is not advised for people with darker skin pigment, because it may result in uneven skin color. After treatment, redness should be expected for a few weeks and a mild pinkish tone may be evident even longer. For very deep, pitted scars, physicians utilize a punch technique. There are several punch treatments available depending on your doctor, type of acne and other factors. The first type is a punch replacement in which a tool is used to remove the scar. Then a skin graft from another part of your body is transplanted over the site. Another technique is the punch excision, where the scar is surgically removed and the area allowed to recover. Finally, there is a technique where the physician removes the scar at the bottom. The skin at the treated area is allowed to rise and fills the cratered area. Usually a punch technique is combined with dermabrasion or laser resurfacing for optimal results. Healing may take up to several weeks. Another type of acne scar treatment is subcision. With subcision, the scar is detached from the lower tissue, which allows a blood clot to form under the skin. The clot forces the scar up to the surface of the skin. Similar to the punch techniques, combining subcision with dermabrasion or laser resurfacing yields the best results. This type of treatment can be effective for all types of scarring, but is best for deeper and more prominent scars. The last type of treatment is augmentation. Augmentation uses a material similar to collagen which is injected under the skin to bring the scar to the surface. Recovery is immediate and no time off work is necessary. The drawback, however, is that results are temporary and only last up to 6 months. Whatever acne scar treatment you decide upon, keep in mind that some may require more than one session with a doctor. Always consult your dermatologist to decide which treatment is best for you. There is a wide variation with the costs associated with the various treatments. Make sure you consider the financial ramifications with your treatment plan before you proceed. Remember, more than one treatment plan may be effective in your particular situation. Each plan has benefits and drawbacks, so make sure you discuss all your concerns with your doctor. Acne scar treatments for acne-free face. Acne, commonly called pimples, is an inflammatory disease of the skin. It is caused by changes in the pilosebaceous. The most common form of acne is known as acne vulgaris, which means common acne. The hair follicles are blocked by the combination of oils and dead skin cells. Comedones, papules, pustules, nodules and inflammatory cysts are the different types of acne lesions. They are mainly caused on the face, chest, back, shoulders and upper arms. These acne lesions are inflamed form of pus-filled reddish bumps that appear mainly during adolescence. There are various factors causing acne. Some of them are the hormonal activities like the menstrual cycle and increased output of hormones from the adrenal glands. Accumulation of dead skin cells, bacteria in the pores, skin irritation or scratching, use of antibiotic steroids, use of medication containing halogens, lithium, barbiturates or androgens, and exposure to high levels of chlorine compounds can also cause acne. ACE treatments can be done with the help of benzoyl peroxide, proactive solution, antibiotics, tretinoin, isotretinoin, contraceptive pills, salicylic acid, adapalene, laser treatment, blue light treatment and herbal remedies. 90% of adolescents have acne. Acne can be treated in various ways. Exfoliating the skin, using topical bactericidals, topical antibiotics, oral antibiotics, hormonal treatment, external retinoids, oral retinoids, and phototherapy are some of the methods of treating acne. The non-inflammatory acne can be treated with azelaic, salicylic acid, topical retinoids and benzoyl peroxide. The mild inflammatory acne can be treated with topical antibiotics. Isotretinoin and topical retinoids are used to treat moderate inflammatory acne. Contraceptive pills with cyproterone can be used by females with virilization to treat severe inflammatory acne. Acne often leaves a scar behind. There are various scar treatments to remove the mark. Dermabrasion, a high-speed rotary wire brush or diamond-coated phrase is used to remove the top layer of the skin to make the scar look less pitted. This is done by a cosmetic surgeon. Microdermabrasion, it involves blasting tiny crystals at the skin and rubbing the skin with a rough tool. Laser resurfacing, the top layer of the skin is burnt off by a laser. Punch excision, a punch tool is used, with the help of which the scar is excised, and the edges are sutured together. Chemical peels, glycolic, salicylic, or lactic are applied to the skin to get a smoother layer in an acid peel. Subcision, a deep pool of blood is created under the scar by detaching the scar from deeper tissue. This blood helps form a connective tissue under the scar, thus leveling it with the surface. Dermal filler, an injectable filler is used to fill up the scar. Maintaining a good hygiene with proper diet and medications help to reduce the occurrence of acne, thus boosting your confidence level and self-esteem.